translation. Oh, thank you, Adam. We are also recording this session so that it can be viewed later by those unable to join us. But if you would like to hear the entire session in English, please go down to the interpretation and click choosing the English channel. If you'd like to hear the session in Bahasa, likewise, please go to the interpretation button at the bottom of your screen and choose the Bahasa channel. For those of you who might also like to use the live captioning, it is in English, we're sorry, but it does give you the graphic going across the bottom of your screen. That is enabled, and you can click on the live captioning as well. So with that, we are going to get started. And if we go to the next slide, I want to tee up the proper welcome and opening, not only to this session, but to the week ahead. And it is my distinct honor to actually introduce our opening speaker. If we go to the next slide, you'll have a chance to hear some wonderful opening comments and words from Juan Pablo Uribe, the Global Director of Health, Nutrition, and Population, and the GFF, the Global Financing Facility of the World Bank Group. Juan Pablo, I'm going to hand the floor to you, and thank you so much.
Laura and Adam and everybody, thanks so much. Good morning and also good evening. I want to welcome everyone to this Nutrition Financing Week. This is the first of several events throughout the week focusing on the financing of such an important aspect of human capital and human development as nutrition. I want to appreciate the work that so many of you have done behind the scenes. It's a good moment to thank you for all that organization, all those efforts. I would mention many names, but you all know who you are. So thanks so much for what you've done. I also want to have 1 minute for a very special welcome to our country speakers from Indonesia. We have today the privilege of having with us Mr. Suprayoga Hadi. He is the Deputy Minister for Human Development Policy and Development Equity in the office of the Vice President of the Republic of Indonesia. And also with him, very nice seeing you. Also with him, we have the pleasure of having Mr. Pungkas Payuri Ali, who is the Director of Health and Nutrition in the Ministry of Planning in Indonesia. So it's a pleasure for us having both of you here, and thanks so much for sharing with us your experience, your lessons, and the way forward in financing in nutrition. I also want to recognize the co-organizers of this Nutrition Financing Week. And it's a beautiful example of partnership and working together, collaborating. We have Results for Development, the Bill and Melinda Gates Foundation, WHO, the government of Indonesia playing a critical role here, the Joint Learning Network for Universal Health Coverage, and of course also the World Bank with HMP, and also with the Global Financing Facility, GFF. So for all of you, thanks so much. Briefly, we all know the importance of nutrition. Nutrition shapes and defines our future. It defines our health, but also our well-being and our capacity to lead joyful and plenty lives throughout our life. It's a critical determinant, and the inaction around nutrition, the cost of malnutrition is just too high for families, for communities, for countries, and for all of us as individuals. Just to give an order of magnitude, the estimated productivity loss from malnutrition exceeds $3 trillion annually. And we can add 2 more US trillion dollars from lost productivity and costs derived from overweight and obesity. So in other words, if we're just looking at the terrible economic cost of inaction around nutrition and proper nutrition, we could say that we're seeing an ongoing, year by year, silent pandemic. And we need to intervene in it. Some weeks ago, closing last year, thanks to the Japanese government leadership, we had a very successful Tokyo Nutrition for Growth Summit. In that summit, recognizing this determinant importance of nutrition in human development, more than $27 billion were committed for nutrition actions in the coming years. This is an incredible effort, a significant effort, but it needs to move from commitments to effective actions. And that's precisely where this Nutrition Financing Week comes. It's a week dedicated entirely to try to learn from others and discuss how to transfer all these resources and all these efforts into concrete nutrition financing actions that can assure effectiveness in improving the well-being of the individuals, families, and communities they serve, that can also ensure efficiency in the utilization of the resources, in the sustainability of those, and extremely important, that can also build institutional capacity, which will lead and sustain these needed efforts throughout years and years to come. That's the whole intent of the Nutrition Financing Week, a unique opportunity, as in the coming minutes, to learn from a country like Indonesia, who is leading by example, doing precisely this, having concrete nutrition financing actions that will shape a better nutrition outcome and therefore a stronger human capital and better well-being for our societies. With this, let us all try to benefit as much as possible from this session and the following ones. And best to all of you, and thanks so much. Over to you, Laura.
Thank you so much, Juan Pablo. So grateful for your words that set the stage for a wonderful and productive week ahead. And speaking of the week ahead, let me share with you indeed what the week ahead looks like. You can see today, as I shared, we are looking at leading by example, this conversation on how to move forward in achieving N4G financing goals. We're hopeful you'll join us tomorrow as well at the same time. Then we're going to be looking at optimizing health financing levers for nutrition, a commitment to action. We're going to see on Wednesday, January 26th, we actually have 2 sessions available for you to attend. The first in the earlier morning hours of the East Coast of the United States. The title of this one is intriguing: The Fizzy Potential of Fiscal Policies for Nutrition, How Taxes and Other Tools Can Encourage Healthy Diets. And then subsequent to that, we're going to have a second session on Wednesday, actually looking at allocative efficiency analysis for more nutrition for the money country experiences with optimum nutrition. Then finally, on our last day, Thursday, the 27th, again, 2 sessions. The first session really looking at nutrition responsive public financial management, strengthening financing and accountability for results. And then our wrap-up session, which will also be happening on Thursday. And we're going to be looking at making the N4G financing goals a reality, a wonderful chance to reflect back on the week we've had and translate commitment into action. Let me help you then get your head around what are our objectives in all of this. Well, our objective for today is to present a broad overview of nutrition financing and introduce key strategic action areas and emerging country initiatives on financing with the accountability to drive results. Likewise, we intend to unpack key strategic action areas on financing and accountability that are going to be further explored in subsequent deep dive webinars as the week unfolds. So we really believe this is going to give you a flavor for what's to come and begin to ground you in the good substantive work that your colleagues, particularly within the countries, have been doing. With that being said, I want to move us to our second speaker, who's going to offer us a bit of a technical overview for the week. And again, it is my pleasure to introduce Meera Shaker, Global Nutrition Lead for the World Bank Group. Meera, please, you are so welcome.
Thank you. Thank you very much, Laura, and thank you, Juan Pablo, for the introduction to this very exciting week. We're also delighted to have Minister Hadi and Mr. Pungas with us, as well as I believe nearly 400 people who have signed up for this session. Laura, let's get started with the next slide. So as Laura said, we are going to talk about the mantra for nutrition financing. And the mantra that we've come up with is that we need more money for nutrition, of course, but we also need to deliver more nutrition for the money that is being allocated. Next slide, please. So why do we care about nutrition? Juan Pablo already touched on this. 149 million stunted children, more than 2 billion overweight, obese individuals. And it's important to remind ourselves, some people think these overweight, obese individuals are rich people in rich countries. Actually, some of the analysis we did last year showed that more than 70% of these obese individuals live in low and middle income countries. And all of this has a negative impact on human capital and productivity. And again, not just investing in nutrition is not just a moral imperative. It's not just a good thing to do. It's also an economic imperative. Even businesses, private businesses, are losing between 130 to 850 billion dollars a year. And this is just for undernutrition, and then more economic impacts on obesity as well. Next slide, please. And this slide particularly focuses on obesity, which is something we in the nutrition community have not done too much about, unfortunately. And this study from RTI showed that in 2019, the world was losing up to 1.8% of GDP due to obesity. If we just let it continue, we anticipate by 2060, we will be losing up to 3.6% of GDP across the world. Just think how much that adds up to. Next slide, please. So we know that the financing that is needed to meet nutrition targets has grown, and we've done some estimates in the past. This is an estimated financing need over the years that we've come up with for the Global Nutrition Report. On top of that, we also added projected costs for COVID mitigation, of course, and you can see that these needs are high and they are increasing. Next click, please, Laura. So in the past, we had estimated approximately $7 billion per year. Now the needs are estimated at closer to $10.8 billion a year. And this is primarily for nutrition specific. Next click, please, Laura. If we actually look at the financing needs for the entire SDG 2 target, it is the early estimates are between $39 to $50 billion, which sounds like a lot of money, and it is a fair amount of money. Next slide, please. But if we look at if we track the financing that has been made available for nutrition, we know that it has been consistently inadequate, unfortunately, even with all the recent updates. Next click, Laura. We see actually that the gap in financing that we are predicting in the Global Financing Report, which is the top bars on this slide that you hear, is still going to be large, despite all the commitments that have come. So all the more reason to be focusing, not just for getting more money for nutrition, but more nutrition for the money. Next slide, please. So I will continue to hammer this mantra. We need more money for nutrition and more nutrition for the money. Even with the 27 billion that was committed at the Tokyo Nutrition for Growth event, we still need more. Let's see how we can get there. Next slide, please. So some of the ideas around getting more money for nutrition on the left-hand side, of course, domestic financing is absolutely critical. And Indonesia is actually a fantastic example of a country that has allocated a substantial amount of domestic resources for nutrition. Of course, traditional aid is important, but there are other sources. For example, many countries are putting in resources for universal healthcare, UHC. How can we leverage those resources for nutrition? How can we use catalytic and innovative financing sources and non-traditional sources for nutrition? We'll talk about some of these things as we go through the week. There's a lot of conversation in the agriculture field about repurposing agricultural subsidies, which are about nearly $700 billion a year. If we can repurpose some of that, that could go to that. Social bond, leveraging venture capital from the private sector, fiscal policies around diet-related taxes, SDG bonds, sovereign bonds, lots of potential how we can get more money for nutrition. At the same time, more nutrition for the money. You hear a lot about this during the week around evidence-based planning, nutrition responsive public financing management, and of course, fiscal levers as well. And not to forget, as we go through all of this, data and data systems are absolutely critical. Next slide, please, Laura. And as we think about that, let me give you an example, and this is just a teaser of a new report that the team has prepared on using, on maximizing UHC financing for nutrition. I won't give you any more details because I know there will be a session on this and going forward. Next, please, Laura. So with that, I want to thank all of you and all of the partners who've collaborated with us for this very, very exciting week. Thank you.
Thank you, Meera. We so appreciate it, and it's a wonderful overview of the road ahead. With that, let me briskly walk you through some what I'm going to call housekeeping pieces that will support our work together in this session. As I shared, my name is Laura. My colleague, Adam Yitna, is the webinar producer for this session. If you have any technical problems, please feel free to private message Adam and he will do his best to get you sorted. If we go to the next slide, you probably are all familiar with Zoom, but we do want to ensure that we absolutely have access to the chat box as well as to the raise hand function, which you will find under your reactions tab. Both of those will equip you at certain points to make contributions and offer input. On the next slide, what you're going to see is what we call our virtual norms. We welcome you to be present and stay engaged. We welcome you being inquisitive and curious about what you're hearing. And please, if you could remain on mute, unless you are offering a verbal contribution, that helps us manage ambient noise. I would simply add, if you can have your webcam on, it's a wonderful addition for us to be able to connect more fully with all of you. And that being said, today's actual agenda looks like this. We've already gone through this first bullet of the welcome, overview, and housekeeping. We're about to welcome an esteemed panel for discussion, looking at 3 themes, followed directly by some opportunity for Q&A with all of you. Then we'll be having our final remarks and looking at a preview for tomorrow's session. So with that, I am delighted to introduce the woman who is going to be guiding you forward, both in hearing from our esteemed panelists and in welcoming the Q&A. I'd like to welcome Alberta Nyaku, the Program Director for Nutrition with N4G. And welcome, Alberta. Thank you so much.
Thank you so much. Thanks a lot, Juan Pablo and Meera, for the opening remarks and for sharing the overview on the progress to date. And thank you, Laura, for the introduction. I'm happy to kick off the panel discussion, which is focused on how to achieve further progress and achieve the N4G financial goals. This session will focus on 3 key themes in nutrition financing, as highlighted by Laura. prioritization of nutrition investments, optimizing financing and fiscal levers for nutrition, and accountability and data-driven finances. We will hear perspectives from country representatives and technical experts. Please make note of any questions that arise and put them in the chat box, as we'll have time at the end of our session for our questions and answers. Let's begin with theme 1, prioritization of nutrition investments. Joining us, as mentioned by Juan Pablo, is Dr. Suprayoga Development of the Office of the Vice President of the Republic of Indonesia, and Jonathan Akwok to share thoughts on theme 1. So I've just welcomed you. Thank you three of you for joining us today. So to Dr. Suprayoga Hadi, my question is, Indonesia has made strong commitments to improve nutrition and has stepped up even during the tough times caused by the COVID pandemic. Can you please tell us how the government of Indonesia has increased domestic financing for nutrition actions? What does it mean to nutrition programs to have a strong financing backing with public funds? We have approximately 5 minutes to share your thoughts with us. Over to you.
Thank you, Alberta. It's my pleasure actually to be here in this very important meeting, the Nutrition Financing Week, the World Bank and the GFF. Allow me to maybe share maybe a short presentation, but my intervention may be mostly related with my presentation actually. Okay. I'm very glad that we are very glad because I and Pak Pungkas actually from Bappenas, National Planning Agency, will be sharing actually the Indonesian experience actually. In my case, prioritizing stunting prevention during the COVID pandemic situation, which is very interesting, and we didn't have any experience before actually. So starting with, of course, stunting prevention acceleration has already been our priority actually, and according to the national strategy for stunting prevention in 2018 actually, we started all the effort actually in how the government in Indonesia trying to cope with the stunting, the nutrition problems at the time, and also the office of the vice president actually appointed actually to do the coordination over the 23 ministries at the central level, 9 key ministries as well as 14 supporting ministries. And we also involved all the districts and municipalities nationwide, also including more than 80,000 villages altogether. And the key strategy is actually what we call the convergence of the intervention, from planning, budgeting, implementing, monitoring, and evaluation. And finally, for the last 3 years, we have been quite successfully, reduced the stunting prevalence from 30% in 2018 into 40% in 2024. Actually, our target nowadays we have about 24% now. And the COVID, of course, has been impacted all the economic aspect as well as the service to the community level, because many, service for nutrition, for health, already been, impacted seriously. And we have been, talking about this for the last 2 years actually. And now we are trying to talk about the prioritization of the financing. We have, shown here actually from the year 2018, from about 24 trillion rupiah and to the 35 trillion rupiah in 2021. Even, this is the pandemic situation actually. we try to be, consistently, increase actually the investment for the stunting actually throughout the years actually. And we have been actually trying to be very much committed actually for supporting the support for stunting reduction investment on our own budget actually in Indonesian budget, the central budget as well as the local government budget. And then you can see here that the prevalence already been decreased from 30 to 24% for the last 3 years, and we still have actually the target actually for the next 2 or 3 years into the 14%. That's our target actually, and we have already been very much committed from the president, the vice president, followed by all the head of the local governments that already been signing the commitments actually to accelerating the reduction of the stunting in their respective region. And finally, some challenges actually post COVID pandemic. Of course, this is going to be quite difficult for us to face with that kind of situation. But again, the convergence is also another issue that needs to be well managed, because there are so many programs, activities financed by a different level of government, and of course the decentralization, because we have already been quite kind to decentralize actually the authority to the local government, as well as of course the target is very limited. The time remaining is only about 2 years from now, which is quite challenging. But again, commitment and also the convergence is very much related with our culture actually in supporting the stunting prevention investment in our case. Thank you. So that's actually my intervention, and I would be glad to have the question maybe later on. Thank you, Alberta. Over to you, please.
Yeah, sorry. Thank you so much, Dr. Suprayoga, for this impressive achievements and reducing stunting along the line. Now, I would switch over to Mr. Akwoku. Yeah. Sorry, just give me a second. Yeah. Yeah, so Mr. Akwoku, as countries, I want to go straight to the, so as countries have successfully just give me a second. As countries have multiple priorities and the budget constraints, in this discussion, we would like to explore how budget holders can make informed decisions on what to invest in and how to distribute resources effectively to achieve not only immediate, but also long-lasting impacts on nutrition, health, human capital, and the economy. So I'd like to hear from you, Jonathan, what are the tools that can you tell us about the tools and approaches, budget decisions on what to fund?
Thank you, Alberta.
Yeah.
Thank you, Alberta, and thank you to Meera, Juan Pablo, and Dr. Suprayoga for the earlier presentations. I think in the introductions, the Meera expressed a mantra of more nutrition, more money for nutrition, as well as more nutrition for the money. And so for budget holders, translating resources into effective action requires tools to support decision-making. There are several tools that are available, a variety of modeling tools to assist with impact and economic analysis for nutrition and to support resource allocation that will have impact in the medium to as well as long-term effects on economic development and human capital. Some of these tools account for multiple interventions. So as you said in the question, there are multiple priorities as well as multiple programs that limited resources will need to support. And some of the usual tools that have been used, if you on the slide, there are examples of some of the key tools that are used to support, produce analysis to support these kinds of decision making. So the Livesafe tool is a fairly popular tool, which specializes in linking the coverage of interventions to health impact. So what will happen if you're able to fund certain interventions to a certain level of coverage, and what would be the potential health and morbidity impact? And the estimates of the intervention impact are based on efficacy data sourced from peer-reviewed journals. For nutrition, much of it is based on the Lancet reviews of effective, cost-effective nutrition actions. Another tool is a One Health tool, which builds on the impact modeling of the LIST model and provides a framework for costing, conducting scenario analyses, and also estimating the budget and health impact of implementing strategic health plans, both with throughout the health sector, as well as targeting specific disease areas. And this can also be used to target a broad array of nutrition programs. Another tool is a profiles tool, which is largely an advocacy tool that's used to model the effect of scaling up, or in some cases, what will happen if you don't scale up nutrition interventions, and the related health and economic, the impact on health and economic development. So these are tools that really look at more than one intervention. There are also other tools that focus really on the single nutrition programs and aim to enhance the delivery and efficiency of these programs. And so these include the World Breastfeeding Costing Initiative tool, which estimates the cost and impact of scaling up the promotion and support services for correct infant and young child feeding practices. And we also have the FUNTA CMAM tool, which supports decision-making around or costing and around establishing, maintaining, and expanding services for community management of acute malnutrition. And Minimod, so Minimod is different from all the other tools in that, one, it focuses on micronutrient deficiencies, but also includes an optimization component, which actually then allows you to not only look at which interventions are cost effective, but also within a limited resource envelope, which ones should you allocate resources to achieve the greatest impact. Next slide, please. So the investment framework, the results from the investment framework were largely based on list modeling for impact of scaling up scenarios, as well as an Excel-based costing model, which allowed us to answer several key questions for reaching the WHA targets. Namely, how much would it cost to scale up interventions if we're intending to reach the WHA targets for stunting, for anemia, breastfeeding, and wasting, and also what the potential impact of investing in those interventions, as well as looking at different strategies for financing the proposed levels of investment. But with all of this, given the limited resources available for investing in nutrition across countries, one of the key questions that remained that policymakers continue to ask was how can they best allocate those limited resources across cost-effective nutrition interventions to make the greatest impact toward achieving national and global targets. And at the time, we did not have the right tools to really to answer this question. The next slide, please. Of the existing tools, none included a component to assess the allocative efficiency of nutrition investments across multiple nutrition programs. And this was the rationale for developing the optimal nutrition model And the optimal nutrition model is a resource optimization tool that can support decision makers to make nutrition investments to maximize impact. It helps to identify the optimal mix of nutrition interventions within an existing or potential resource envelope that will make the greatest impact toward achieving strategic nutrition targets. And the model, the analysis from the optimal nutrition model can also form an important component of nutrition public expenditure reviews, which I think during one of the sessions, we will cover some of the experience with nutrition public expenditure reviews. But as an optimal nutrition model, that's a component of an NPR, can assess also whether expenditures on nutrition are optimal given the country's strategic targets and how to reallocate existing resources to increase impact on nutrition outcomes. The nutrition community has mobilized to improve investments in nutrition, and optimal nutrition aims to ensure that we get the most nutrition for the money. So answering that second part of the mantra, more nutrition for the money invested. So optimal nutrition was based on implementations of allocated efficiency models that have been developed and successfully deployed. And these include optimal nutrition models for HIV, for HCV, for TB, as well as malaria. And the most, I think the most prevalent, widely used one is the optimal HIV model, which supports some of the decision-making for countries receiving global fund resources.
Jonathan,
yes.
Please forgive me about 20 more seconds.
Sure.
Thank you so much.
Sure, thank you. So one of the sessions this week on Wednesday, as was said earlier, would be on exploring some country experiences on using the optimal nutrition tool, and we would welcome you to come and join us during that session. Thank you.
Thank you so much to you both. The tools exist, and there are ways of optimizing financing for nutrition. So next, we want to turn our attention to our second theme, optimizing financing and fiscal levers for nutrition. In this next theme, panelists will explore how to optimize financing and the emerging reforms, initiatives that are available for better nutrition outcomes. Our panelists are Michelle Mehta, nutrition specialist, and Bethany Warren, senior public health specialist, both from the World Bank. So we'll start with Michelle. My first question is, as countries pursue universal coverage, how can we ensure essential nutrition actions are funded and delivered in quality, especially through primary healthcare services? What are the key financing levers to improve the effective coverage of nutrition services as a foundation to achieving universal health coverage? And also, what are the challenges and opportunities? So over to you, Michelle.
Thank you. Thank you so much, Alberta, and welcome to everybody. I'm so excited to be here and looking forward to this week ahead. This is a great question, and it's especially exciting as we are at such an important moment right now as countries are moving towards UHC. And there are really some big opportunities to better integrate actions to improve nutrition. I think up until now, most of our efforts have focused on making the case for what cost-effective nutrition interventions should be scaled up, as well as why they are critical to UHC. But there's been less emphasis on the how. How can nutrition be improved as an integral component of primary healthcare systems and of UHC frameworks? So in particular, adequate and efficient financing is a fundamental constraint to improving nutrition. We need to take strategic and concrete actions in order to sustain and strengthen the financing for nutrition, and particularly domestic financing. So we have an opportunity now, and that is to align UHC-oriented health financing arrangements, that is revenue raising, pooling, and purchasing, with nutrition objectives. And the purpose here is really to address the many underlying service delivery and financing bottlenecks that do contribute to the low coverage and quality of nutrition services. So I wanted to share some examples of what we mean by aligning health financing arrangements with nutrition outcomes. First example is that countries can raise revenues for nutrition by implementing and institutionalizing a systematic evidence-based prioritization process with resource allocation that uses high quality data to accurately and equitably reflect the disease burden of nutrition, as well as the costs of implementing nutrition interventions. And this really will ensure that nutrition is well covered in the benefits package. Countries can also employ pooling mechanisms, and these are with nutrition budget analyses, such as tagging and tracking, as well as allocative efficiency analysis, like you just heard with Optima Nutrition. These analyses generate timely data on resource availability and spending for nutrition that will ultimately help to reduce fragmentation. And lastly, implementing strategic purchasing mechanisms can ensure adequate incentivization of particularly preventive and promotive nutrition services. An example of this would be moving from input to output-based financing. So when we apply a nutrition lens to these health financing arrangements, we can achieve equity in the resource distribution, efficiency, transparency, and accountability within this framework for achieving universal health coverage. And this is particularly essential when we look at meeting both the WHA global nutrition targets, as well as the nutrition and health SDGs. And just to add one more point here, when we talk about integrating nutrition within UHC, we're really focusing on a few key elements, and that is including nutrition in the benefits package, like I just mentioned. Also delivering nutrition with good, high quality. And that really emphasizes the need to examine all of the health systems building blocks, and to ensure that nutrition services are well examined, well defined within those packages. Also strong accountability mechanisms to monitor service delivery. An example I think of this would be, when we look at an ANC package, does this include iron and folic acid supplementation for pregnant women? And lastly, as mentioned, sustainable and efficient financing, with the ability though to monitor and to track financial data and linking financing to performance. So these are some of the key elements that we will discuss more in tomorrow's session on optimizing health financing levers for nutrition. So we hope most of you will join us, or all of you will join us, and we look forward to that discussion. Thanks so much, Alberta, back to you.
Thank you so much, Michelle, for sharing these policy options with us. Finally, let's move to the third theme, which is accountability and data-driven financing.
Alberta, forgive me, I think we need to turn to Bethany before we go to the third theme.
Oh, okay. Yeah, sorry for that. Yeah, Bethany, we now turn to Bethany to share her thoughts on this.
Sure, thanks, Alberta. I think I'll speak on, there's been some questions about the growing enthusiasm and interest in utilizing fiscal policy measures to improve nutrition. Mm-hmm. And so we'll be exploring this in a session on Wednesday. So I'll spend a moment now just sharing a little bit on that. And so I think we should start first by establishing what are the fiscal policy measures to improve nutrition that are gaining interest that we'll talk more about on Wednesday. The fiscal policy measures for nutrition, their objective is to create a difference in retail prices between healthy and unhealthy food and drinks, Fiscal policy measures could include a range of options, from taxes to subsidies, incentives, and price controls. A variety of approaches have been used in practice to date. For example, Saudi Arabia, South Africa, Samoa, and several other countries tax sugar-sweetened beverages to discourage consumption. Mexico has an 8% tax on non-essential energy-dense foods, in addition to a 1 peso per liter sugar-sweetened beverage tax. Hungary has a 5 to 10% tax on prepackaged foods with salt or sugar above a threshold. And these are just a few of the many examples of what fiscal policies for nutrition are in practice and what they're hoping to achieve. And then the question of why is there growing enthusiasm and interest in these types of policies, and why will we be spending some time digging into them deeply on Wednesday? Really, it's a confluence of factors. First, as others have highlighted earlier today, and this audience is aware, the staggering prevalence of obesity and non-communicable diseases are impacting the health and quality of life of people around the globe and putting immense pressure on already strained healthcare systems. In addition, it's increasingly universally believed that healthy food options should be equitable and accessible to all. Another reason there's growing interest in this is that nutrient profile models are also gaining traction, and they can be a useful tool to help identify different categories of foods and make implementation of these measures easier. And finally, at the same time, there's a large and growing evidence base to support fiscal policies for nutrition. The evidence to date, which is one of the focuses of the deep dive session on Wednesday, demonstrates that these fiscal policy measures can be an effective tool to decrease consumption of unhealthy foods, increase accessibility of healthy foods, and promote positive health outcomes, including decreased mean population body weight, improved quality of life, lives saved from cardiovascular diseases, and reduced healthcare expenditures. And we've learned this from other analogous products. We've learned a lot from other public health fiscal policies for tobacco and alcohol, and now have substantial evidence from sugar-sweetened beverages on their ability to improve diets and prevent non-communicable diseases. And we also have early real-world evidence for promoting healthy diets as well. In addition to modeling studies, some early champion countries have tested and begun implementing these policies, and we can learn from their successes. So there really are a number of reasons these policies are gaining traction. It's a very interesting and exciting time for this area, and we look forward to the in-depth conversation about these policies on Wednesday, and hope you all can join us. Thank you.
Thank you so much, Bethany. Apologies for jumping over you. We are so anxious to get this whole agenda through today. Yeah, so far we have heard, we've discussed prioritization of nutrition investments and potentials of untapped financing options. But how do countries ensure that funding is going to the right services, the right places, and to those who need it most, and that we are getting the most of limited resources? In this next discussion, panelists will discuss data needs and accountability mechanisms to help ensure funding is tracked and financial data is used to inform policy decisions. We are happy to welcome another esteemed panelist from Indonesia, Dr. Pungas Buhari Ali, Director of Health and Nutrition, Ministry of Planning, Indonesia. Dr. Pungas is going to be joined by Weiwei Wang, Senior Economist from the World Bank, to help us explore this third and final theme. So I welcome our two panelists. Let me start with a question for you, Weiwei. Public expenditure reviews are used by many sectors as a rigorous analytical tool to inform resource allocation and planning, like health expenditure reviews or agriculture public expenditure reviews. For nutrition, what are the recommended ways of using this type of tool to maximize the return of the investments? What are the top line lessons learned from past experiences? Over to you, Wei Wei.
Thanks. I just want to make sure everyone can hear me. I tried to share my screen, but I'm not sure you saw it.
We can
Yeah,
see it,
it's
Wei Wei.
showing.
We can see it, Wei Wei.
Yeah.
Okay, great. Thanks for having me here. So I just want to say it's really, really pleasure to be here. And also part of the reason I'm here is because over the past year, I've been leading a team preparing a guiding framework for nutrition public expenditure review. It's exactly what you said, how to do that and how that can be best utilized by the government and stakeholders. So this work was built on country experience from doing sector PERs and the nutrition PERs. So hence, we also have some sort of takeaways and top line lessons for you to have a peek. We are going to have a dedicated session on Thursday, but these are just some highlights. So to better utilize a nutrition public expenditure review, I think first of all, we all need to know what an NPER can do, what benefit it can bring to us. You already mentioned some of them, Alberta, in your question, right? Like, it tells countries how much they spend and whether it is equitable, whether it is efficient, whether it achieves the goal and objectives. So that's exactly, I think you have to know the benefits in order to know that how to utilize it. Then the second point I want to highlight is undertaking nutrition public expenditure review is relatively new. It's not like, health PRs, agriculture PRs that have been done for decades. And so this is relatively new. So to best utilize it, I think, it needs to be better understood by policymakers and practitioners from different backgrounds. For example, some of us, we know nutrition very, very well, but we don't necessarily know what PER is. So for this camp, then they need to know some basics of the NPERs, like I said, the benefits, first of all, and, what it requires in order to do a PR, what skills, what data, what budget, a preparation process, what are the main parts, the key elements, key analysis, and so on and so forth. So they need to understand that part. And then we have another camp who probably knows the tool very well, the public expenditure review, but they don't necessarily understand the peculiarity of nutrition. It's multi-sectoral nature, and it's a service delivery model, it's financing mechanisms, and so on and so forth. So the gap needs to be bridged between different camps, so everyone can understand how to do it and how to best utilize it. The next point I want to highlight is nutrition public expenditure review needs to be situated in a country context, undertaken with government ownership. I said that because it's very sort of analysis heavy, but that doesn't mean it's an intellectual exercise, it's an academic exercise, purely like that. It's really a sort of a policy analysis exercise. It needs to be embedded in the country's context, to take into consideration the country planning process, for example, and the country's public financing arrangements, and the country's service delivery model I mentioned, and also the data system, like how they are monitoring and how they are doing the monitoring and evaluation, what kind of data they have. So by taking into consideration all these factors, then you can better inform through NPER, has the budget followed the planning? Yes, it's in the planning document. Is there money flowing? Is there money following? And if there is resource allocated for nutrition, has the resource flown to the frontline healthcare workers that providing nutrition services? So understand all these points by embedding the NPR exercise into a country context and has the governmental leadership. And I also want to emphasize, start doing it despite challenges and take an incremental approach. Because once you start doing it, or maybe before you even do it, you will know so many challenges. You might not have the data, you might not have the counterpart, you might not have a perfect team, and so on and so forth. But unless you do it, those challenges will always be there. We have so many countries for which their experience we incorporate into the guiding framework. They already did it. You know, sometimes even if you're just doing a partial one, you know, you don't know whether it is equitable, you don't know it's efficient yet or not, but you know how much you spent. That's a progress, right? So take an incremental approach and do it, do a full-fledged over time. And the last one, but not the least one, I cannot emphasize enough how much important it is to strengthen the data system. As I said, it does require a lot of data. It is a quantitative exercise, right? It provides evidence. So countries have to strengthen the data system. But when they have a purpose, when they know what kind of analysis they will be doing, they can collect better data-wise. Otherwise, you know, you collect data for no reason and you don't know how you're going to use it. The data will be there sitting forever. So we have country examples that have already started doing tracking, tagging the nutrition expenditure because you have a purpose. You know what you need to analyze and what you know what kind of emphasis, policy analysis you want to inform. So really, I think the data strengthening and undertaking this analytical work, they have to go in parallel and mutually enhancing each other. And I understand there will be also, you know, discussions about countries' experience talking about tagging and tracking. So hopefully this serves also a nice segue to that topic. Thank you so much. Happy to take questions later on, if any. Thank you.
Thank you so much, Weiwei, for sharing your thoughts on these policy options on expenditure reviews. Now, I'm happy to move over to Mr. Pungas with a set of critical questions to further extend our thoughts on what we just highlighted. My question is, Mr. Weiwei, can you share Indonesia's experience in strengthening the planning and budgeting process to accelerate the reduction of stunting? What are the key reforms to enable this process? How does this affect the program performance, allocation, and utilization of nutrition spending? And how can other countries learn from this experience? Over to you, Mr. Pungas.
Thank you, Alberta, for the opportunity. First of all, I would like to thank for having me here to share the Indonesian experience in strengthening the planning and budgeting process. Is one way of how to accelerate reductions of stunting in Indonesia. Next slide, please. As Pak Yoga already mentions, it is a very long journey, and we are still learning from the efforts that we have made so far. In the National Medium-Term Development Plan 2020-2024, Indonesia is clearly stated that the target for stunting prevalence should be 14% by 2024. This target was incorporated into the plan after the president of Joko Widodo stated his commitment in 2019. In the last 8 years, stunting prevalence has been decreased consistently. The stunting prevalence was 37.2 in 2013, and now the prevalence came down to 24 in 2021. However, the challenge remains high. Indonesia needs to reduce stunting to by 10.4% within 3 years to achieve the targets. To do so, we prepare for strategies. The first is to advocate to high-level policymakers And the prime target, of course, is our president. And in fact, the highest positions that are taking this issue back in 2013 is our vice president, which is now the chair of steering committee for stunting reduction program. And the second is how to formulate the relevant policies in short-term as well as medium-term development plan. In fact, stunting is one of the major projects in our development plans. This is what we call it cream of the creams of the projects that every year is set up by Bappenas. And once you are in these positions, then you have a high attention, especially for budgeting. And number three is how to prepare financing mechanisms involving the relevant ministries according to the national strategy and presidential decree. In fact, we have an annual forums for consolidating this stunting planning and budgeting. And the number four is how to secure budget allocation from ministries to support the national priorities such as stunting reductions by using tagging and tracking system. Budget also comes from fiscal transfers, local government's budget, as well as village fund and non-government funds. Village transfers in the health sectors, drinking waters, sanitations, and early childhood development, as well as family planning. A local government budget allocates specifically for stunting, which are monitored and approved by the Ministry of Home Affairs annually. And then last but not least, the village is also provided a budget. We call it village fund. It is an open menu for the village to use it for stunting reduction program. On your next questions on the key reforms, next slide. Yeah, next slide, please. The key reforms to enable this process, well, I define it as there are three key reforms. First, it's to set the targets to be achieved by its ministries. So the target for presidential decree on acceleration of stunting reductions. So we establish the indicators and targets that the ministries and local governments should be responsible for. We also monitor the budget allocations to provide feedback to report the presidents. Second is on budget tagging and tracking, where we apply tagging and tracking system for nutrition specific and nutrition sensitive intervention annually. And this involve collaboration with the Ministry of Finance and Ministry of National Development Planning. And the third is we use fiscal transfers. In Indonesia, we have a decentralized systems. So each subnational government has the authority to manage their area. Therefore, to ensure that the national priorities such as stunting reductions are implemented at subnational level, we provide fund for the central governments. This reform affect the program performance, allocation, and utilization spending in two ways. Obviously, we are now able to secure ministry budget for nutrition. And second, we can synchronize the activities across ministries for specific targets. For example, we can allocate funds for local-based supplementary food. We can specify sustainable food garden for program to target the first 1,000 days of life. And we can ensure that the interventions are delivered to the same locations. My last slide is on the lesson learned. Yeah, from the past decades, we learned the following sessions. First is the high-level commitment is very important, but the commitment should be incorporated into the national development plan, the national budget plan, and monitoring plan. Then the commitment should be strengthened by established regulation. Second, budget tracking and tracking could be used as a tool for policy making. It is a strong triggers for the ministries to implement the plan they committed to support stunting reduction. Budget tagging and tracking could increase their feeling of ownerships and awareness. And number three, a formal reporting system should be introduced as well. The system should be integrated into routine scheme, including 6 monthly monitoring and annual evaluations. Indeed, we have already 2 rounds of this report to be presented to the government, to the parliaments. In fact, this is the only programs that government reported annually, very specifically and details into financial notes to the parliaments. So then we need to continue the advocacy, the importance of 1,000 days of lives as our main targets. Thank you.
Thank you so much to our two panelists on strengthening the planning and budgeting processes to accelerate nutrition outcomes and how to use public expenditure reviews. Now, we are now going to our questions and answers session. And so I'm going to ask for the help of my colleagues, Kyoko Okamura, nutrition specialist from the World Bank Group, and Ali Subandoro, senior nutrition specialist, also from the World Bank Group. Kyoko and Ali have been monitoring the questions in the chat box throughout the session. And so they'll help us identify a few questions to be addressed with the time we have remaining. So I would like to start with Kyoko. Can you share with us any questions you have seen? Over.
Yes, thank you, Alberta. Thank you everyone for participating and the questions. Just to note again that we would welcome any questions that you may have to be posted in the chat box. So the first question I would pick up is from the Emily from International Institute of Rural Reconstruction, San CSA, Philippines. She comments the impressive work done by Indonesia. How exactly did Indonesia address the challenge of ensuring convergence and being able to harmonize plans and implementation of various government departments and stakeholders? Mr. Punkas, would you like to address this question? We welcome your response in 2-3 minutes. Thank you.
Yes, thank you, Keiko. I think my personal view is that because we started the programs by have a sharing visions on how to reduce it using the logical framework that's developed by UNICEF and Lancet. And from then on, we put it as formally into national strategy, which is signed by vice presidents. And then several years later is signed by president as the presidential decree. So that's answer that everything is in place. So ministries has obligations to do it because it's already in the regulations. But I think the other the key factors is how we have a very regular meeting. We have a forums. For my part, is on planning and budgeting. We do have an annual forums, multi-stakeholders in the beginning of fiscal years to ensure that each ministries have their allocations, and then by the end of the year we report it to the presidents, and we did it. As for the subnational levels, there are 8 steps that have been devised and agreed by the local government, as well as Yoga already mentioned earlier. They already signed the pact that something will be their priority. And we, along these programs, comes fiscal transfer. So we are not only give them some advice, but we also have set up how to finance this through the fiscal transfers. So I think that's the key, how the convergence can happen, even though our challenge now is on the data, on the field, how we ensure that each individual's family with 1,000 days of life have got all of these activities or targeted by ministries from the central level. So there's still a challenge now. And I think once we got at the convergence at the grassroots level, that will be very, very ideal. Now we mostly converge at the central and the districts, but we have to go down again to the individual level. Thank you, Gero.
Hi, Pak Pungkas. Thank you very much, Pak, for the very succinct basically very to explain, right, how Indonesia is actually doing it. May I invite Pak Yoga? Pak Yoga, perhaps if you can also just come in very quickly on how Indonesia basically managed this convergence from the highest level. And I know your office from the Vice President office has played a very key role in terms of ensuring the collaboration across sectors, across all basically across both across sectors as well across level of government. So please, Yoga, if you wanna maybe come in here just for just briefly on how this convergence being managed also at the Vice President office. Thank you, Pak Yoga.
Thank you, Ali. I would like to add and also addressing the very good question from Emily. Salamat po. I think it's going to be very good to start with the planning itself, as Pak Pungkas already mentioned, because from 2018 we have the national strategy for stunting reduction, and it turns to the new presidential regulation on the stunting reduction acceleration, which is very much as a Bible, something like a Quran actually, for how we are dealing with different line ministries, different layer of the government that needs to be converged actually, because otherwise it is very chaotic actually. Every single sectors, every single ministry has their own programs and also activities. As mentioned also that by Pak Pungkas, that we also have the medium-term development plan. We have also now the action plan for stunting reduction acceleration provided by the National Agency for Population and Family Planning, which is very important actually as our roadmap, something like that, on how we are dealing with stunting reduction towards 2024 actually, in how we try to reduce from 24% to 14% in the next couple of years actually. And what we also have in the local government, which is also very important, that we have the action for convergence action, something like that, that already been implemented by the local government. Because we are not only talking about the one layer of the government at the central level, which is the 23 or 25 line ministries involved, but also we need to consider the 514 local governments that needs also to be converged actually, or integrated actually, their effort actually to reduce the stunting. So that's the thing that we need to make sure that all the plan, all the strategy already been documented very well and also regulated. And finally, the investment is coming later on. So planning, budgeting supposed to be in line with what we are dealing with the convergence in the stunting reduction in Indonesia, as well as in the local government level. Thank you, Pak Ali.
Thank you so much. Kyoko, do you still have any more questions?
Yes, there's a related question for Hue from John Sebastian, WFP headquarters. His question is, NPRs define their own classification boundaries and can therefore cover multi-sector interventions. And PERs can assess issues of funding efficiency, but they are generally resource intensive. So it'll be good to read further specific guidance available for nutrition on that. And bearing in mind that PERs are usually designed as a one-off study because it's quite rigorous. Do you have any thoughts on how to have NPERs institutionalized or carried out with a certain regularity? Where would you like to address this question?
Thanks, Kyoko, and also thanks for Sebastian for raising this very insightful question, and it's very relevant. Like I said, it is not an easy exercise. And in terms of classification, once you read the guidance, guiding framework, you'll see that we try to sort of link the analysis with the Livesafe framework in terms of how to define nutrition activities. So so that you adapt to nutrition instead of you adapt nutrition to the tool. And it is resource intensive, and oftentimes it was designed sort of as a one-time exercise. I think you are right. And part of the reason was because the data challenges, right? Like, you wanted to see how the nutrition spending has been contributing to reduction in stunting, for example. But oftentimes stunting came with DHS data, for example. It's once every 5 years. And then you cannot do it more often than that if you want to examine that question. And also part of the reason it's resource intensive is because the nutrition expenditure data is not easily identified in the budgeting system, right? So teams have to spend a lot of time to dig the data, to make assumptions, to tag it, to sort of decode the system in order to get those estimates that contribute to this intensity. So that's why I emphasize in my sort of top line lessons from the government. I think that you need to do it just to get a snapshot, to understand where things are and to understand where the gaps is. But this will not fully solve the problem if countries do need to strengthen the data system to start tagging and tracking the expenditure so that you can link that with also your routine monitoring and evaluation system so that you can start building that gap and to see how much I'm spending and how much this is contributing to the results improvement. So I would say this is part of the institutionalization process. And at an ideal point, if you have all these routine system to track expenditure, to measure results regularly, on annual basis, quarterly basis, then maybe it's not so much of a point to especially conduct NPER because those analyses can be just built upon the routine analysis and you carry it with the country routine process like planning process, the sector review process, and so on and so forth. So I hope this helps. Thank you.
Thank you, Weiwei. Kyoko, if we have a little bit time here, we can take a few more questions if we have.
Okay, I would like to ask Ali to pick up a question, the related question again on the Indonesia's subnational arrangements. Ali?
Okay, yes, thank you. So we have a question from you, Benel Oakley, asking. So basically, the question is that this policy and strategy at district village level is complicated with the presidential decrees and the ministerial as well as parliament. And this, so basically, how the district level rationalize and interpret these different policies in light of the nutrition plan? How do they include these plans into the district medium-term plan? So if I can maybe ask Pak Pungkas to address this question, and in particular, I think this has been mentioned briefly by Pak Yoga, that basically as part of the program, we have the district convergence action plan. So please, over to you, Pak Pungkas, if maybe you want to sort of provide some explanation how this district convergence action plan and other support really build the capacity for the subnational level. Please, Pak Pungkas.
Thank you, Pak Ali. Well, I don't think that is complicated if we look at the way how the regulation works. If I would say that there are two main frameworks that will be the main framework for the stunting reduction program, and other regulations actually are some kind of stream from these two regulations. The first one is on the medium-term plan. We set up what are the target in the medium-term plan at central level, and that the new thing in the personal regulation now is that the district governments as well as the province governments has to put, it's mandatory for them to have a stunting reduction program as their targets in their medium-term plan. Usually this development target is not mandatory, it's discussed between the central and local government. But in this case, because the president wants to reduce stunting and it's very steep. I mean, from 24 to 14, then we need to put it in the RPJMD, medium-term plan at local level. And the second regulation, which is provide the framework for overall regulation, is the new presidential regulations or presidential decree, which is basically set up the target at the each ministry's national level, as well as setting the mandatory target at the district level. So all the targets, all the line ministries regulations actually based on these two regulations. So once we are consistent with these two regulations, it should be complicated at the local level. I think the complications comes in, especially in how to deliver the program effectively and efficiently. When you're looking at 19 ministries are going down to the districts, then the question is, what is the target? How is the target? I mean, it can be to everyone if we are not coming in the convergence level. So that's why at the district level, there is a guidance on how to run the programs in convergence manners. Terima kasih, Pak Ali. I think that's hopefully answered the questions.
Thank you so much. Kyoko, we have a few, we still have we can take one more question, I think.
Okay, so this is a final question from John Sebastian, again from WFP headquarters. The question is for Whitney. Will your session discuss or present additional information on the technical assistance required by countries to design and implement taxation of unhealthy foods, beverages, etc.? Whitney, you have a few minutes left. Thank you.
Sure. Thanks, Kyoko, and thanks for the question. The focus of the session on Wednesday is the evidence to date and what the future could look like for fiscal policies for nutrition. We'll cover the breadth of kind of what fiscal policies for nutrition can include, what the evidence is that they work, examples of countries currently using them today, and then experiences of policymakers implementing them. We'll have country representatives sharing experiences of what prompted implementation, what it takes to implement the process, result, lessons learned for other countries. And so while the focus of the session on Wednesday is more the evidence for fiscal policies for nutrition and the potential for the future, we'll certainly touch a little bit on design and implementation through that process, and agree that's a very important piece of this. And I hope that answers your question.
Thank you, Whitney. And also thank you everyone for contributing through the chat box, including the role of civil society, all the partnerships that are happening on the ground. We hope you will also join the deep dive sessions and share your thoughts. Back to Alberta to wrap up the Q&A session.
Thank you so much. All the questions, very, very important questions that are very useful for us to take the main actions needed to improve sustainable financing in nutrition. And thanks to all our participants and our panelists. And right now, I'll just hand over to Meera to bring our sessions to a close. Meera, over to you.
Great. Thank you very much, Alberta. And thank you to everyone, really. It's been a very, very interesting session. I'm not sure about everybody else, but I certainly learned a few things this morning. So as we go on towards the rest of the week, I do want to remind ourselves that based on the questions that came just now and the conversations we've just had, there will be many answers to the questions you've raised, and the three themes reminding ourselves. First, around prioritization of nutrition investments, which is in sessions 2 and 3, and that follows tomorrow. And then the second theme on optimizing financing and fiscal levers in sessions, again, 2 and 3. And the third theme around accountability and data-driven financing. So the first theme, we will start covering it tomorrow. The second theme will be in the following days, and the third theme going on forward from there. And the last day, oh yes, thank you for that. So session 2 is really from 8 to 9:30 in the morning tomorrow. I hope you'll all be there bright and early to join us for that session. And I want to emphasize one thing as we close this session. I'm delighted that the two co-organizers, particularly Kyoko and Ali, have really focused this session on country level actions. And all of you who heard from Indonesia have heard how well they have done by focusing on the issues that Indonesia has focused on, having an excellent target, focusing on convergence, focusing on scale, but also at the same time ensuring domestic financing for nutrition in Indonesia, and then using the tools that the presenters talked about in terms of improving the efficiency of that spending. So in the coming days, we will be doing a lot more of that. And we will also try and make sure there's enough time for discussions. So with that, let me finish and say a big thank you to everybody for joining us, and a big thank you to also the team that is helping us with the logistics. We did manage to make it on time, and we will try and keep this time. Also, again, a big thank you to Minister Hadi and Mr. Pungas for joining us today, sharing the experiences that Indonesia is having, but also staying through the end of the session. That is amazing. I hope you'll join us for some of the other sessions as well. Thank you, and see you tomorrow.
Bye-bye. Thanks, everyone.
Thank you.
Bye-bye, everyone.
Thank you.
Thank you.
Thanks,
We'll see
everyone.
you tomorrow.
Bye.
Thank you, Pak Yoga, Pak
Appreciate you.
Pungkas.
Take good
Bye-bye.
care.
Thank
Thank
you.
you.
Thank you.
Be
Bye.
well.
Thanks, Ali.
Bye.
Yeah. Oh, terima
Thank
kasih. Bye,
you.
Alfie. Thank you.
Bye, everyone.
Bye.
Thank you, Hakim. Pak Iing, thank you.
Thank you, Bali.
Bye.
Yeah.
Pak Punggas, Pak Yoga.
Take care, everyone. Thank
Thank you,
you.
everyone.
Thank
Good
you.
night.